Welcome to Conversations in the Clinic. I'm Dr. Kelly. Today I'm joined by Dr. Scott Hanauer of Garden State Pain and Orthopedics. Thank you for being here, Dr. Scott.
Thank you so much for having me.
Yeah, it's my pleasure. So we'll get right to it. What inspired you to become a podiatrist?
Well, so throughout my childhood, unfortunately, I was born with pretty flat feet. So I got to see the podiatrist pretty often growing up with my own foot issues. Then, as I got older, approached high school, I knew I wanted to become some type of doctor. I wanted to go into the medical field. And during my time in undergraduate in college, I shadowed an orthopedic group that had a podiatrist who was the foot and ankle specialist of the practice, who um, really showed me what podiatry entailed, to getting to treat flat feet and broken bones and broken ankles and bunions and the whole uh, field of podiatry. And I really loved it, and uh, that's the path I chose to go now.
Love it. I'm always interested because, like, I can do the physical therapy side of feet, but a day full of feet, I always admire those doctors who are
Yeah,
like, yeah, sign me up for that.
you
I
learn to
can't
breathe
wait to
through
do
your
it.
mouth.
I guess so. Yeah, you have to. And I used to treat a lot of high schoolers who would come in after practice and they take their socks off. And
Yeah,
it was like, and now I get patients who are like, hey, I didn't shave my legs. And I'm like, that's okay. I
yeah.
deal with high schoolers and their
The
feet.
best is patients who apologize for not having a pedicure. I'm like,
Oh,
oh, you believe me, this is nothing.
come
This
on
is
in.
fine.
Come on
Thanks.
into the door. Cool. Was there a particular patient in your time shadowing that you were like, ooh, they really stood out to me, or I saw this doctor make a big difference for them, and that's why you want to get into it?
Yeah, there was a time during my training. It was a patient born with club feet,
Hmm.
where it was treated when they were born. It was not fully corrected, so they grew up with a pretty severe deformity, limp, not able to walk correctly. During adolescence, they came to see us in their training, and we were able to reconstruct their feet. They went through pretty major reconstructive surgery. But throughout the years after correcting both sides, it got to the point where they sent us a video of him back to running
That's cool.
for the first time correctly in his life, and that was
Yeah,
a pretty cool experience, just seeing him back to being able to do the things that we take for granted. Um,
totally. Yeah, that's cool. I always laugh of like, there's always a one or two patients that they stick in our heads, and they're
oh
like,
yeah.
this is why I do what I'm doing.
hmm
I love that. So, what's the most kind of common foot or ankle issues that you see and you treat?
I'd say most commonly we see plantar fasciitis or heel pain,
Yep.
otherwise known as a heel spur syndrome. We see that very often. Achilles tendonitis or Achilles injuries, Achilles ruptures, as well as bunions and hammertoes, forefoot deformities, um, and generalized sport injuries. Ankle sprains would probably be the most common as
Sure.
well.
Sure. Do you see a lot of teenagers come in with those?
A lot of
Yeah.
teenagers, a lot of high school athletes,
Yep.
very, very common.
Yep. Um,
As well as the weekend warriors,
yeah,
like
you're
me, anyone in their 30s to 50s who they still think they got it, and they very quickly realize that they don't got it.
they don't, not at least with a good warm up and adequate strength training
Yeah,
ahead of
exactly.
time. Sure. Um, is there any specific like approach that you have to treating any of those conditions that you take any kind of pride in?
Yeah, I like to really over communicate with patients and be as open and transparent about their treatment as possible. I think it's very common in medicine um, to explain the pathology to a patient in a way that kind of dumbs it down. And in my opinion, I think that I really like them to know exactly what I'm thinking,
Yeah.
from what the beginning of their treatment's going to entail, from the conservative treatments all the way from plan A, B, and C. In a worst case scenario, this is where we may end up if things are not improving.
Yeah.
So I think if they understand the timeline from the first time we meet, they know exactly what I'm thinking. That they walk out of the room knowing a game plan. Very often you kind of black out in a doctor's office and you walk out of there and you're like, I don't really know what he just said.
Yeah.
And I want to make sure that my patients leave there knowing exactly what the plan is from plan A through plan D.
Yeah. I think that's really important. I try to tell my patients, like, go in with your questions written down and
Yep,
bring someone if you can. Because having
definitely.
a second, it's often, I do the same thing in here of like, I leave them with a list of like, this is the common stuff I say that I've probably said during your evaluation. And here's plan A through plan Z,
Yep.
right? And having backups and very clear expectations along the way. And, um, I think that's really important, and I think that's lacking a lot in the
Yeah, it's
field.
tough, especially when you have such limited time with your specialist.
Yep.
And, I think it's important to walk out there knowing what condition you have and what the strategy is to treat it.
Yeah. Um, that's huge. I see a lot of plantar fasciitis in here. That'll probably be a whole nother episode because spend an hour talking
Yep.
about it.
Yep.
Um, so what early signs should people watch for when it comes to foot and ankle problems?
Yeah, I think in general, listening to your body when something
Yep.
is usually it starts in some patients it just comes on acutely. You wake up, you take that first step and you're like, oh, what is this? This is new, this pain. And but in other times it starts off as more of a discomfort and you assume it's gonna go away. I think that's most of us,
Sure.
there's a new pain and you assume I slept on it weird, I misstepped, oh, I was wearing those shoes yesterday, that probably set it off. And
Yep.
that is typically the case.
Yep.
I think once a few days have gone by and that pain is still lingering, your body's trying to tell you something. Something is not right. And especially as we get older, we're not teenagers anymore. These things just don't go away on their own
Yeah.
anymore. They tend to linger.
That's why I like
So,
treating kids.
yeah, that's right. Kids
Kids
get
get
better,
better
and
fast.
adults just don't.
Yeah.
And that's the truth. I dealt with my own shoulder injury, and that was the same thing. I just sat on it for months, and and you realize you're like, oh wait, this isn't going away.
Yeah.
So listening to your body and something's not going away, seeking out treatment and seeking out a specialist to find out what's going on. The earlier you seek out that treatment, typically the better the treatment's going to go.
Yeah.
Um, more often than not, if it's caught earlier, and especially if you diagnose it earlier and get into physical therapy and get the treatment you need, you'll stop it from progressing to a more severe injury.
Yep. Love that. I say it all the time. Listen to your body. Um, cool. So kind of in that same arena, when is it important to go see a podiatrist?
Yeah, so I think typically with your feet, it's pretty hard to ignore pain. You're
Mm-hmm.
walking, you need your feet, and
Mm-hmm.
when something hurts, you're thinking about it every step you take.
Yep.
So, in my opinion, when it's been more than a few days, especially let's just say it's not a direct injury. If
Yep.
it's something where it's a new pain that just started, like I said, whether it's from a new pair of shoes or you woke up with it, um, after a few days, if that pain is still lingering, I usually just recommend getting in as soon as you can.
Sure.
And I think that if you get in within that first week of the onset of the pain, I see the best results more often than not. And that includes trauma too. If you have a
Yep.
bad ankle sprain or your ankle twists, not just to rule out major injury, ruling out a fracture,
Yep.
but typically we've seen in orthopedic care these nowadays that early active range of motion, getting patients into therapy,
Yeah.
it's not about immobilization
Yep.
anymore like it used to be. I haven't
Yep.
put a patient in a cast in years. We don't
Yeah.
do that. We get them straight into physical therapy, and if you ignore your pain for too long, then that's when we tend to see the stiffness and the long term repercussions from injury.
Yep. As you were talking, I was thinking about I've seen a handful of kids or teenagers who broke their ankle, but mom or dad were like, "Nah, it's not broken."
Yep.
And then 3 days later, their foot is, the size of a balloon, and mom or dad go, "Hey, we should probably get that looked
Yep.
at."
Yep.
So, it's helpful to hear that even in cases of trauma, you're not sure.
Yeah. And I think it's hard because nowadays in healthcare, in a case of a trauma, you think in your head, well, should we go to the emergency room? And so many people, including myself, want to avoid the ER like the plague.
Yeah.
And even urgent cares, they want to avoid it.
Yeah.
So to me, I think it's the better way and the better path is to go directly to the specialists, such as myself. More often than not, we have X-ray in our office. We have diagnostic ultrasound.
Yeah.
We can rule out the scary stuff first.
Yep.
We'll make sure nothing's broken, make sure everything looks okay, make sure you didn't rupture a tendon.
Yep.
And once you rule those things out, then now we can say, okay, let's kind of settle down
Yeah.
and figure out what are the next steps here.
Yeah. Yeah, I think that's super important, and it's good to have access and to know who to go to. To have somebody kind of on, not on speed dial, but in your first couple
Yeah.
of contacts to say, "Oh, I know who to go to," and
Yep.
and let's get in and go see, that provider. Are there any new treatments or innovative treatments in the field that you're excited about?
Yeah, so foot and ankle surgery is moving towards more of a minimalist approach,
Mhm.
minimally invasive surgery. It's not always fun to cut open into feet and ankles.
Yeah.
Gravity pulls all the swelling down there, so
Yeah.
things stay swollen, things get stiff. So the smaller the incision that we make, usually the less scar tissue that builds and the better range of motion patients have and the less pain patients have.
Yeah.
So we're trying to do a lot more of our procedures arthroscopically
Yep.
and minimally invasive, especially when it comes to forefoot surgery. Minimally invasive bunion surgery
Yep.
has been a game changer in the industry where we get patients walking same day in a boot. They're back in sneakers within 4 weeks from their
Wow.
surgery. So it's not that dreaded surgery like you've heard about in the past where patients are in a cast and
Yeah.
all these horror stories from bunion surgery.
Yeah.
Things are changing if you find the doctor who's trained in the newer technology that's come out.
Um, that's incredible because I always say you never see a lot of ankle replacements. You see
Yep.
plenty of knees, you see plenty of hips,
Yeah.
but like it's God did a great job when he when he went
Yeah.
with the foot because it's just incredible down there, and I give you
Yeah.
guys a lot of credit
It's a
because
very complex joint.
yeah, it's
It
incredible.
moves in a few planes, and that's also what makes it so difficult to replace.
Yeah,
It's
yeah,
made it. The industry has finally, in the last 5 to 10 years, started to pick up where we have these 3D printed, CT guided ankle replacements that have made it a lot easier to replace ankles when we need to. But you're
yeah,
right; it's way less common compared to the amount of knees and hips that are replaced.
yeah. I would imagine because it's a very intricate, beautiful
Oh yeah,
joint. As much as I can't, I wouldn't stare at feet all day. God bless you. But I look at my models of the feet and I show patients, hey, look at all the bones, look at all the
yeah,
structures that have to coordinate to get you out of bed. Just like you
yep,
said, things we say take for granted every day, right? To squat, to drive, to do all the
everything.
things that we need to be able to do. So it's really cool that there are new innovations coming out to
Yeah.
minimize the amount of swelling and get people moving. Just like you said, it's really really important. Um, love that. So, what roles does preventative care play in maintaining foot and ankle health?
A huge role. I can't tell you how many foot and ankle conditions are related directly to having a tight calf muscle,
Mm,
whether that's overpronation, flat feet, Achilles tendonitis, plantar fasciitis, midfoot pain, can all be directly related to what we call equinus or a tight calf muscle.
okay.
So in patients who are proactively stretching out their calf muscles,
Yeah.
increasing their range of motion, um, it makes a huge difference. It really is the number one treatment. If you go see a doctor for any of those conditions, the number one thing I'm going to tell you is you need to stretch. You need to go to PT.
Yep.
We need to work on your dorsiflexion.
Yep.
So, really, stretching is going to be the number one thing. Working on that ankle range of motion.
Love that.
Number one preventative treatment you can for most foot and ankle injuries.
Love that. We're gonna go over some things after this. You just gave me an idea of like,
Great.
oh, yeah, yeah, we gotta check some dorsiflexion out, and I like to tell folks like that's the range that gets you up and down a stair. That's the range that gets you up and off a toilet. Like
Everything.
we don't realize it. Like, what do you mean we got to fix my ankle mobility
Yeah,
because my hip hurts? Like, nah, it probably is coming
it's all
from the
related.
tightness down through there. Um,
Yeah, and same thing with, like I said, with flat feet. Patients don't realize, if we're talking, for one of the things we do, flat foot reconstruction. When I tell either the parent or the patient, and I say we have to lengthen the calf muscle, they're like, "But the calf doesn't hurt." I'm like, "But
mhm,
you don't understand that the calf being tight is what caused this in the first place.
yeah,
That overpull from the calf is causing that equinus and is causing that overpronation. Um, so it's related to everything in the foot and ankle.
yeah. Um, good. Yeah. Again, that's another episode we'll do. Um, this is awesome. Um, okay, my final kind of three favorite questions here. Which you've touched on a couple of them, but if you could give one piece of advice to the world regarding your specialty, right? Because as much as fun as it is to treat patients, we'd rather not see them come to
Yeah,
us with non-traumatic problems. What would that piece of advice be?
I think it would be don't take your feet for granted.
Mm,
And on top of that, be your own advocate when it comes to your health. Don't wait. You have to listen to your body, and when something is not feeling right, you have to actively do something to get it better. Don't wait on it and expect it to just go away. So seeking out the care and being proactive is really the best thing that you could do. And same thing with your health. I think the more that you actively keep your body in shape
yeah,
and stretch and stay flexible and work out, you're going to decrease the risk of a lot of these injuries that are associated with the foot and ankle.
yep. I, louder for the people in the back kind of thing,
Yeah.
right? Like
Yep.
I love that of we have to be proactive, and it can be really hard. It can be really intimidating in a world of healthcare where it's like, well, the doctor said this. And I think the younger generation is getting a little more information,
Yeah.
and our parents and our grandparents are like, well, but the doctor said to do this, so that's all I'm going to do.
Yeah.
And it can be really hard to advocate for yourself when you know if
You
something's
have
not
to.
right.
And it's surprising sometimes. One of the things I do before surgery, any surgery I do, is I'll ask the patient, "Do you remember what are we doing today? What's the
Mhm.
plan for surgery?" And it's concerning how many patients walk in and they're like, you know, something. We're
You're
fixing
gonna fix
something.
it.
You're fixing the
Yeah.
thing on my ankle." And I'm like,
Yeah.
you know, I take the time to make sure that you know exactly what we're doing. And you should also, just like I should take the time to explain it, you should want to understand it because
Yeah.
this is your body.
Yeah.
This is your body, and you have to be your own best advocate when it comes to your health.
Yeah.
Because unfortunately, in healthcare, the coordination between specialists and is just not there.
Yeah.
So if you're not the one to be your own, if you're not the quarterback, if you're not the one to
Totally.
really organize your own care,
Yep.
then it's easy for it to kind of be forgotten about and left behind.
Yeah. Yeah. And having that autonomy as the patient to say like, yeah, I am in charge of this. It is important that I do this. Hey, Dr. Scott, before you go in there, which tendon are we fixing?
Yeah,
Right? Or what hardware are you
I
using and
love
what's
that.
going to be important?
Yeah, I love when patients come in with those questions, and they're very often they're apologetic for saying, "Oh, I sorry, I did some research on Google." And I said, I love that. I
Yeah.
love that you come in knowing you know some of the anatomy already. You
Yep.
just look this up. I respect that because at least it means you care.
Totally.
You
Yep.
put in at
Yep.
least some effort to understand what's going on.
Yeah. Yeah, that's huge. And it is, it's really cool to like, I wish more people knew about the anatomy of it.
Yeah,
Cause as soon as they look and they realize like, oh my gosh, all of this is going
it's
on in
great.
there. It's incredible.
That's why I have pictures of the anatomy of the foot and ankle, throughout the office
Yeah.
because patients, when they sit in there, they look at it and they're like, "Oh my god, I didn't realize that there's so many bones, so many
Yep.
muscles,
So
ligaments."
many muscles, there's so many, right? Blood vessels and how important they are. And it's so funny because I'm sure you've seen your share of, ingrown toenails
Mhm.
and things that are, less traumatic and less significant, put that in air quotes, to deal with, but those hurt.
They hurt the
Right?
most.
Like those are like,
They hurt the most. That's what gets most people in
I would
right away,
imagine,
right?
yeah.
They like
It's like get the help. It's like
yeah.
a toothache, but
I always
it's
say it, like,
awful.
you could get, punched in the arm,
Yep.
and that still isn't as painful as an ingrown toenail
Oh, it's
sometimes. Yeah.
brutal. It's brutal.
Yeah, it's tough.
And like you said, you totally take it for granted until something goes awry, and then
Mhm.
you're like, wait a second.
What did it feel like before that?
Right,
What was
right,
it like?
right.
Yeah.
And like, oh, I promise if this goes away, I'll never take it for granted again.
Yep.
Yeah. Simple things like getting out of your car and going for a run. That's awesome. So kind of in that arena, like, how do you practice what you preach?
Yeah, so I think in terms of my own health, I'm very on top of, I could be a little bit better with the stretching. I think that's the hard for everybody. However, in terms of exercising, I take time, usually 6 days a week. I try to go to the gym. Mental health, I think it's equally as important to work out your brain as it is your
Mhm.
body. Some meditation, some yoga, to stay in a good mindset, and also just staying up to date on what's out there in terms of what's the best treatment, what are the
Yeah.
best technologies out there in order to stay in the best health possible.
Yeah.
um, yeah,
Yeah. I love that. Are there examples of that? Are you like a ice man or a sauna guy or anything like that?
big sauna guy.
Yeah.
Yeah, love the sauna.
Okay.
I do love cold plunge.
Yep.
It's hard. I just moved out of the city, but I moved to
Okay.
Hoboken. It's not so easy to get access to
Into a
a cold plunge,
yeah.
but whenever I do have access to it, I love it. I think it's great.
Do you?
It's like an all natural
Yeah.
uh boost of dopamine. I mean, you really feel you get out of that and you're ready to take on the world.
Yeah.
You feel amazing.
Yeah.
Have you ever
I have
done it?
done them. Yeah, I have done them. I was a couple years ago. I was training for a half marathon, and I knew like I just have to do it, right?
It's
So I coach high school sports, and I went to our athletic trainer's office, and I got 5 big bags of ice, and,
it's
it's great. It's great.
it's great.
Yeah. And a matter of fact, I was walking my dog 2 weeks ago outside of the fire department, the call volunteer fire department, and there's a guy sitting across the street staring at the firehouse, and I looked, and there's 3 firemen sitting around a guy in a nice
Oh my God.
just go, and I was like really proud of our town for
Yeah,
having that as an
it's
option
great.
because it's a great recovery tool, and it's the research on it is really strong for the dopamine and the, you know,
Yeah, cold
take
shock
aside the,
proteins, and
yeah,
same thing
yeah,
with the sauna. It's
yeah,
really
yeah,
has great cardiovascular effects and benefits.
yeah. Not to mention the part of your brain that's like, I can do hard things,
Yeah.
right? The psychology there of like, yeah, this is terrible, but
Well,
it's
that
good for me.
exactly. That accomplishment you feel when you get out. You're
Yeah.
like, I've, faced this challenge, and knowing that you kind of got through it and succeeded
Yeah.
is
Bring,
nice.
bring on the operating room,
Yeah,
right?
exactly.
Yeah. No, I love that. Okay. So this is my favorite part of conversations in the clinic where I do rapid fire questions. So we have a handful on here.
Bring it on.
Ready?
Let's do it.
Set. Favorite food?
Pizza. Well, that wasn't really very rapid fire.
That's
Okay,
okay. You got it.
I gotta
Pizza.
get better.
Where do you get pizza from?
Well, now that I moved out of the city,
Yeah.
it's not, but at Prince Street Pizza and John's off Bleecker, but
Okay.
still going
That's
into
true.
the city.
All right. I like it. Best vacation you ever took?
Amalfi Coast.
Was it delicious?
It was amazing.
Yeah.
The food was amazing. The people are amazing.
Yeah.
It was really the best place to be.
I love it. Okay. Dream vacation.
Greece.
Yeah. I got engaged in Santorini.
Did you really?
Oh
That's
my gosh,
amazing.
that was, oh, it's incredible.
Yeah.
Yeah. And then a week later, I broke my wrist.
At
So that was the
least it
story.
wasn't a week before.
That's true.
Yeah.
That's true. Favorite sports team?
Yankees.
Okay. Favorite restaurant?
Hillstone.
Okay. And one thing you wish more people knew about you?
That's tough.
Yeah, it was really rapid fire.
I really blew the rapid fire part.
No, you're okay.
I guess my personality, my empathy. I'm a very empathetic person. I really like to listen to people. I think there's part of me that was meant to be a therapist. I really like listening
Yeah.
to people's problems and
Yeah.
trying to find a way to help them with their problems. It probably helps. I grew up in a family of women. I have 3 sisters, I have 5
Okay.
nieces.
Oh,
Very
yeah.
used to the,
Yeah.
every
Laying it on you.
every night felt like it was an episode of,
Yeah.
Dr. Phil.
So-
So that's probably why.
He's an empath. I love
Mhm.
that. Awesome. Is there anything else that we missed? Anything you want to share with our community?
Yeah, I think that as a patient, it's especially nowadays in healthcare, when you have such limited time, your appointment always feels rushed with a lot of providers. And very often providers can be very dismissive
Yeah.
of your symptoms, and
Yep.
you feel like they're not listening. And like I said before, you really have to be your own best advocate when it comes to your health.
Yeah.
So don't accept if a doctor's just telling you, tough it out, or this is what it is, like this, that is not an acceptable answer. And pain is not, you're not meant to be in pain
Yeah.
all the time.
Yeah.
So if that's the case, don't accept that for an answer and
Yeah.
keep going.
Yeah.
And, same thing with any, not just when it comes to foot and ankle, but any health problem that you're dealing with, keep going until you get the answers that you're looking for.
Yeah. Goes along with what you said before about plans A through Z. Right?
Yeah.
If Dr. A dismisses you, go to Dr. B.
Yeah.
Let's figure it out.
Keep going. Always get another opinion.
Yeah.
I say that to any patient I'm recommending surgery on. I say, go get 3 opinions, go
Yeah.
get 4 opinions.
Yeah.
Choose the doctor you feel the most comfortable with and that you trust, and that, but don't just take my word for it.
Yeah.
I think it's good to get more opinions. So like I said, you have to be the one to take charge when it comes to your health.
Yeah.
Don't expect the healthcare industry to do it for you, because unfortunately not everyone is going to be there for you in the way that you want them to be.
Yeah. Yeah. I love it.
I
Anything
like
else?
to think that I am, though.
Me too.
Yeah, I think we both are.
I think so too. But yeah, it's a hard industry to navigate. I think for the layperson, I have a hard time navigating it as a fellow provider. So it's really
Yeah.
important to hear other providers say that. And it comes from a place of humility and advocating for your patients.
Yeah.
Listen, I know what I'm doing. I think this is the best course of action, but go talk to these people and see. Let's get plans D, E, and F on
Yeah, of course.
on the radar, in case we need them. So I think it's really important to advocate. I really like that word that you used. And believe that there is an answer, that you don't just have to live with that. I have so many patients, I'm sure you do too, who we come in and after a session or two, they're like, oh my gosh, it's starting to feel better. I didn't
Yeah.
know that it could start to feel better.
Yeah.
Right. And it's like, do we just have to find the right path, right? And the right recipe and the right amount of salt and pepper
Yep.
to make it work. Yeah.
Yeah, exactly. You have to keep going.
Yeah.
Don't accept no as an answer. And if you're getting no as an answer, then you find somebody else.
Yeah.
Find someone that takes the time to care and that listens to you. At the end of the day, it really stems with, I think, the doctor is just not listening. They're
Yeah.
not, they may not be listening to what you're saying. And because if they were listening and they heard that you're in pain, they would keep going.
Yeah. Yeah.
They should keep going.
Yeah. I love it. Awesome. Well, thank you. Thank you guys for watching. Thank you guys for being here.
Thank you. Thanks for having me.
Yeah, we look forward to seeing you again for our conversation
Absolutely.
about plantar fasciitis.
Absolutely.
Awesome. Thanks.